Hello, my name is Märta Lauritzen. I am a registered nurse and urotherapist.
And my name is Helena Thulin. I'm a registered nurse and PhD, and we work together at Karolinska University Hospital in Stockholm, Sweden. Today we will show how we insert indwelling catheters. First of all, it's important that the patient is informed and give his or her consent for the procedure. Secondly, it's important that the patient is relaxed so they can relax the pelvic floor muscle. And to achieve this, we can ask the patient to have the hand on the abdomen and take a deep breath. It's also important that I am comfortable with the procedure. It's something else you think about?
Yes, I think of the risk for infection during catheterization. And to avoid this or decrease the risk, we have two principles that we follow and we want you to follow. First is keeping the catheter sterile during all the process. Secondly is to protect the patient from bacteria from ourselves and the environment.
It is important to consider your own hygiene, so make sure you have antiseptics at hand, as well as plastic apron, and that you apply basic hygiene procedures. Start by opening the catheterization kit. First you will find the sterile gloves, but you can put them aside for now. Pour some sodium chloride irrigation solution into the tray. Place the catheter gel on the sterile field. Remove the catheter from its packaging while carefully keeping its sterility and place it on the sterile field. Fill a syringe with sterile water that you will use to fill the catheter balloon with at a later stage. Only now put on the sterile gloves. Prepare the anesthetic catheter gel syringe. Remove the EVA bag and place the catheter into the tray. It is important to follow the producer's instructions. The BIP Foley catheter should be pre-wetted to activate the hydrophilic coating. You can use sterile water or some of the sodium chloride for this as long as you use cotton pads that don't release any fibers into the liquid. Change of a supra-pubic catheter. To facilitate the procedure, it is preferred that the bladder is filled as much as possible, as the line from the entrance on the abdomen to the bladder itself becomes straight. Fill the bladder using sterile sodium chloride, maximum 3 deciliter, or until the patient feels the urge to urinate. Complete this stage by closing the catheter with a plug to prevent the fluid to back out. Carefully clean around the insertion hole to avoid loose particles or textile fibers to enter with a new catheter. Deflate the balloon that normally is filled with 10 milliliters of fluid, which is enough for most catheters. When the balloon is empty, take a note of how much has been withdrawn for later documentation. The next step is to remove the catheter, which sometimes can be a little challenging. Hold one hand against the patient's abdomen and gently pull the catheter with the other hand. A small cramp in the abdominal muscle might force you to take a little break in the process. Small talking to the patient to get them to relax can help at this stage. It is important that the patient feels as relaxed as possible. When the whole catheter has been removed, a little urine can appear, so it is advisable to put a cotton pad to keep the patient clean. Now it is time to place the new catheter. As with urethral catheterization, there are different ways to enter the catheter itself in a sterile way. Remove the cotton pad and place the hand on the patient's abdomen. We advise to use catheter gel. In this case, it both prevents pain and lubricates for easier catheter insertion. Let it work a little while. Observe the patient while you're placing the new catheter to make sure he or she doesn't experience any pain. Get some urine in exchange before you inflate the catheter balloon. To avoid that the balloon is inflated in the abdominal wall instead of the bladder, make sure to enter it far enough. If you don't have a tray, as in this case, close the catheter with a valve immediately. Fill the balloon with 10 milliliters of the fluid that the catheter producer recommends. Remember to constantly observe the patient. This shouldn't hurt. Finally, pull the catheter slightly towards you so it has the right position. Feel that it can move freely. To protect the patient's clothes, you can put some protection around the catheter itself.